and you got vaccinated before June the 2nd, 6 months has gone by. Go get your booster now. Go get it now. Booster shots continue to be free. We've already made available 80,000 locations, coast to coast in the United States of America, 80,000 locations to get the booster. And if you want to know exactly where to go, text your zip code to 438829 to find where you can get your booster shot now.
All right, let's speak now to Emily Landon. She is the Executive Medical Director of Infection Prevention and Control at the University of Chicago. Emily, are you optimistic that these latest measures, including increased testing, will work to get a hold on the pandemic over the winter months?
Well, certainly we know that adding layers to our prevention efforts makes a difference. And so adding testing, adding boosters, encouraging people to wear more masks, putting some restrictions and sort of bumpers around the travel is very good and can definitely make a difference. Omicron, we just don't know enough yet to know whether or not it's going to be a real problem for vaccinated individuals, but it makes sense to get boosters now.
Yeah, and I wanted to ask you about that because the president is urging Americans who aren't vaccinated yet to get vaccinated, and if they are vaccinated but 6 months have passed, to get a booster. But do you really think that will make a difference? Because so far it seems like the people who have tested for this Omicron variant have been vaccinated, and then at least one person did in fact have the booster.
Yeah, we are definitely over testing the population of individuals who have already been vaccinated and have boosters but still get breakthrough infections. They are more often sent for sequencing. So it's hard to know the true likelihood that someone is going to have a breakthrough infection. There will be breakthrough infections, probably even with boosted individuals, but hopefully they'll be less severe and less common than in individuals who are unvaccinated. That is, vaccines are not an on-off phenomenon. They work somewhere between 0% and 100% of the time. And by having more antibodies, a fresher vaccine, by getting a booster, you can certainly push up that percentage for any virus.
And what about what we're seeing in Europe, where some countries are imposing lockdowns on unvaccinated individuals and imposing vaccine mandates? Do you think that's the answer, even as it seems that the vaccinated still can get these breakthrough infections and spread the virus?
Well, when it comes to Delta, we know that vaccine makes a huge difference. And the more vaccinated people you have, the less likely you are to have sustained and continued community spread, and fewer individuals who are vulnerable will end up in hospitals. So when it comes to Delta, it certainly makes sense to do some of these measures like requiring vaccinations. I'm really hoping we can avoid having any more sort of lockdowns for individuals here in the United States, but I think we're getting to a place where it's very reasonable for elective activities like entertainment things or participating in things in person that you don't necessarily have to do in person, requiring vaccine for those things in order to reduce the capacity for those events to have spread. Now, with Omicron, it's going to depend a lot on how effective the vaccines are, whether or not vaccine mandates are going to be wildly successful or less successful. Of course, a vaccinated individual is always going to be more protected than someone who's not vaccinated, but the magnitude of that protection may be different with Omicron.
All right, and we'll leave it there. Emily Landon joining us from Chicago. Thank you so much.